All right, ladies and gentlemen, welcome back. Joining us now is Senator John Barrasso, Republican of the great state of Wyoming, former orthopedic surgeon for 24 years and chairman of the Senate Republican Policy Committee. Senator, I welcome you. I know that this is obviously something very close to your heart, and it's close to all our hearts, and we haven't talked about it because of everything that's going on in the world and in this country and the elections and you name it, and that's Obamacare. And I was not surprised, but I mean, it blared out at me when I saw this this headline that U.S. emergency room visits keep going up despite Obamacare. And one of the selling points of Obamacare was we can't keep having people go to the emergency room for their medical treatment. So what's going on?
Well, you're absolutely right. A survey of over 2,000 emergency room doctors, people who know because they're working in the emergency room, say that the volume has gone up in many places significantly in the emergency room. And part of it is that so many of the people that are on the Obama health care plan have been put there on Medicaid, a program that we know doesn't work. Many doctors don't take it at all because it pays so little. Even doctors that Health and Human Services say do take patients, it's about a month to get an appointment. So the ERs are getting swamped, which is the exact opposite of what the president promised the American people. And the impact then on an emergency room, if you have a real emergency, is that the time to see a doctor goes up, as does the morbidity, because people end up having to wait too long for treatment of a serious issue like a stroke or a heart attack.
Right. And this is a result, and correct me if I'm wrong, of people who, as you said on the floor of the Senate, have been pushed onto Medicaid because of Obamacare, and they can't find doctors who are taking Medicaid, so they have to go to the emergency room for primary care.
Well, you know, the president made sure we had a lot of IRS agents hired under the health care law to look at your taxes, but not doctors or nurses to actually treat your medical problems. So, you know, as I've said from the beginning, coverage does not equal care. And the president has always said, I'm going to get more people covered. The headline is more people covered, but that doesn't mean they can actually get care, and it's become a lot worse problem for emergency rooms. And as you and I have talked in the past, emergency rooms are where the care is the most expensive.
Absolutely, yeah. You ever get a bill from God forbid, you have to go to an emergency room, you get hit in the head or a cut or you get chest pains? It's outrageous. By the way, I don't know if I said Medicare or Medicaid, but I meant Medicaid. Let's talk about a solution. You know, you and I have discussed this also. Republican plan to combat this. I keep hearing more and more that there's no way now that the Republicans could I mean, look, the budget, for the first time in 6 years, you guys got a budget. You're not defunding Obamacare. So how are you going to fix this?
Well, you know, we cannot fix Obamacare, but we can fix health care, working to give the patients the care they need from a doctor they choose at lower cost. And like Washington made this mess. Washington can't solve it. I want to get the decisions being made at the state level, where states can decide what kind of insurance people need, and people can decide for themselves. I want to get rid of this individual mandate that makes people buy all this expensive insurance. You know, the president calls these things the essential benefits. To me, they're excessive benefits that a lot of people are ending up paying for. So we need to get this decisions made much more closely to home, and I think that's one of the things that will help drive down the cost of all of this care. But you're right, the health care law did not fund enough training for enough of the health care providers to take care of people. We have a shortage of nurses, doctors, all different levels of people taking care of patients, and that's one of the real challenges that we face as a society, where people are living much longer lives and in many cases healthier lives, and the president's health care law, I think, made it much worse from a budget standpoint because the costs are so large.
All right, we got about a minute left. Let's talk about the Iran bill on the Senate floor. What's going to happen with that?
Well, we are going to put a bipartisan sanctions bill on the president's desk, so the president has to come to Congress, the Congress of the elected representatives of the United States, before he goes to the Security Council of the United Nations.
But can he get that with just like 30-some-odd votes in the Senate? Isn't it
we're going to get a chance to see the deal when it's cut, and then we will make our case to the American people why we think it's a bad deal. It can only be a good deal if it's enforceable, if it's verifiable, if it's accountable, if the inspections are anytime, anywhere, instead of making an appointment for next Tuesday, because we all know, and this is Republicans and Democrats know, that Iran with a nuclear weapon makes the world less safe, less secure, and less stable.
No, absolutely. All right, Senator, as always, thanks for joining us, sir.
Thanks for having me.
My pleasure. Take care. Yeah, folks, we can't lose sight of Obamacare and the disaster that it is and that it's been and that it will continue to be. And when emergency room everything this president promised about his bill has not come true. It's all been lies, misinformation, disinformation, and or a total failure. From premiums and costs and to keep your doctor, keep your insurance if you like it, to emergency room visits going down, it's all been a failure. Give Me 5 is next.